Part 5. Removal of dam. Steps. It includes cutting the septa. So we have to cut the septa first. Before that we can even select the thing to remove the clamp, either one. Usually we can go with the removal of clamp or cut the septa according to our convenience. So here if total quadrant has been isolated, then cut the septa. If single tooth, then directly go to the removal of the clamp. Once you remove the clamp, then remove the dam sheet. Then wipe with the lips. Rinse the mouth and massage the lips. So here we can suggest our patient to apply little bit of gel after the treatment also for the convenience. So before sending the patient, we have to floss the contact points and examine the dam sheet. That is very much important. So if any dam sheet is there inside, it will irritate the soft tissue and patient may have again discomfort. That's the reason we have to check the contacts and send the patient. And another important, when we are doing any class 2 restorations, especially we have to check the smoothness surface of the proximal box with the floss and then only send the patient. So let us see the video of that. See here the attachments. So if you are placing the wedgets, then you have to remove the wedgets first. If you are placing the floss tie, you have to remove the floss tie. So the first step will be the removal of any attachments. This is the blind technique which we have already discussed. Since if a blind technique is not being used, here we are getting many foldings. That's the reason we are using the blind technique. Then slowly, after removing, slowly cut the septa. Again, the placement of our frame, it can be from the top or it can be from the bottom. For the documentation purpose, from the bottom, see as in this video, it is better. It appears very neat once we do with the from the bottom. Again we have to check any residual sheet is inside the contact point. If it is there, just you have to remove with the floss. So you may be having a doubt if you're keeping a rubber dam in the patient, how to take the radiograph. Just move the rubber dam sheet to one side and place this film holder. That is one technique. And another technique is remove the frame and drop all your rubber dam sheet to one side corner and place the film and take the radiograph. So, and another third solution is that you can use articulating type of frames. With that you can fold it and take the radiograph. Any one method you can follow here. Mishaps in Rubberdam. So in Rubberdam mishaps, it has been divided into, for our convenience, diagnostic mishaps, placement mishaps and procedure mishaps. In diagnostic, we have to do case selection, proper selection. So diagnostic, if it's already a class 2 where it has been grossly decayed or restored and you are placing a clamp on it, all the previous restoration, everything will get chipped off. So we have to do the proper diagnosis. And grossly decayed tooth, it will be brittle. When we keep the clamp on that, it has more prone to the dislodgement. So that is the reason the solution over here is you have to place the clamp on the next tooth of that, distal tooth of that, or else you can use SG clamp, SG type of clamp. Next point is cervical abrasions. See, already due to the cervical abrasion, neck of the tooth is very narrow. Again you are placing your clamp on the narrowest part. They are more tender, they are more brittle for the fracture. So that's the reason, especially in the premolar cervical abrasions, never try to place the clamp. So place, if you want to do any arch in the premolar where it is having cervical abrasion, then place a clamp on 6 and open a section or else quadrant isolation and perform the things. 2 labially placed anterior teeth. Yeah, if anterior teeth is 2 labially placed and you have placed your rubber dam, so during the access opening procedure you cannot understand the angulation and there is a obviously default of making a labial perforation due to the improper angulation. So here if you have any tooth which is more labially placed or more palatally placed, you have to see before that only the angulations, then open the access opening, or else you can make a small ditch where you want to do and place dam and continue. because we don't want to make any type of perforations. And tilted tooth, like imagine 6 is missing and your 5 has been mesial drift is there, then you have to follow, for axis opening you have to follow the long axis of the tooth. Here once you place the rubber dam sheet, you will get confused to locate the long axis of the tooth. So here again I would like to give the suggestion that make a ditch to the long axis and place the rubber dam, so that you will not make any errors. Placement mishaps. Off-centered arch form. If you have not placed your template in a proper position, or you have placed more top or more bottom, the rubber dam sheet will cover the nose and patient will have a difficulty in breathing, or else it will not cover even the upper lip. So both the things are incorrect. So it should have been placed in a proper way. If it is covering the nose, then we can make a small window. I'll be showing in the further videos. You can see there, inappropriate distance between the holes. When the tooth are crowded, if it is inappropriately placed, then you will be having the foldings. So place the rubber dam sheet on the crowded tooth, mark with the marker pen, then make it whole. Inappropriate retainer, obviously you know that there will be a leak. Retainer pinching the tissue, it's too much painful for the patient. Of course, if you are giving LA also, then the patient will not have pain, but trauma will happen. Again, healing rate will take time. Torn dam, if your punch is not making the hole in a proper way and your dam sheet is very thin for your resistance towards the stretching, then it will get torn. Incorrect technique of cutting the septa while removing. These are the placement mishaps. Errors in rubber dam placement, yeah. So as this picture is showing, there is an error. The rubber dam sheet is covering the nose. Patient cannot breathe properly. So how we have to solve the issue? Make the cut in a U shape, so that patient will feel comfortable and you can perform the procedure. Punching arch form is too small. The holes are stretched open around the teeth. Permit leakage. See, here there is a leak, here there is a leak, here again there is a leak. So how to solve this issue? We can just simply relieve the engage the forceps here, relieve the clamp and push your rubber dam sheet inside a little bit towards the, so that it hugs the tooth. Then again place the clamp. Okay, then that will solve this problem. If the punch arch form is too large, the dam gets wrinkled here like this, okay, around the tooth and interfere the axis. In that situation, first option would be adjust your frame once again. If that also it's not working, then make a blind clamp. I think I have told you and I have shown you the video of blind clamp also. Procedural mishaps, like perforation in the crown structure of upper and tilted crown, narrow crown structure, pre-endo buildups, pain management. Again, pain management is a good thing. If you are not managing the pain properly, patient will not cooperate, then you will not get the success. So all this procedure, placement of a rubber dam, it's not at all a time consuming if you practice in a thorough way. If you practice, single motion technique can be done in just 2 minutes or even less than that time. Imagine if you have a case, okay, of upper 6 RC, you want to perform a single motion technique. Just let the assistant, you know the tooth number, just you can do the clamp selection and the assistant make the hole. They'll make the frame adjustment. Then slowly you take it from their hand and adapt the clamp and place it to the patient mouth. How much time it will take? Less than 2 minutes. Okay, if you want to do open any section or quadrant, those are little bit time consuming, I know that, but even though we can, once we practice thoroughly, we can reduce that one, because we have advantages of using this rubber dam. Let us use that opportunity. Conclusion, I would like to conclude. Isolation of the treatment area provides the ability to create an aseptic and a dry environment and improves manual control together with efficiency. Whichever color, so here I don't bother about the color, thickness or elasticity or application technique. It can be all in one, dam first, clamp first, single motion technique, split dam technique, any technique. The rubber dam improves both the patient's experience and the comfort and the practitioner. Thank you.